Okay, awesome. So, welcome to another episode of the Nashville Network Alliance, the podcast where we come together to share expertise, strengthen connections, and work towards making our city a better place for everyone. Today's episode, titled How Better Understanding Your Hormone Cycle Will Change Your Life, will take an in-depth look at the universal 28 female monthly cycle. We'll explore the four common phases of this cycle and how they influence your motivation, mood, appetite, cravings, and even exercise performance. We'll also share simple strategies to help you feel more balanced and healthy. Our guest today is an inspiring first generation medical student at the University of Tennessee Health Science Center. She's a women's health researcher with published work on factors influencing women's attitudes towards hormonal therapy, as well as different treatments addressing HIV in South Africa. She's an amazing person and future OB-GYN doctor. Without further ado, please join me in welcoming the brilliant and inspiring Katie Shearer.
Yes, hello. It's so nice to talk with you about this. I was looking stuff up beforehand to make sure I don't misspeak on anything.
No, I'm so excited, and I know you're the most perfect person I can ask about some of this stuff because I remember when we would study in the library, you would tell me all kinds of things I didn't even know about, our cycles, and it's crazy to think about that this is, something that happens to 50% of our world population, but we don't learn about it in school, like in, grade school. And even in undergrad, I didn't learn a lot about our hormone cycle and how to navigate the different hormones and, how it can affect our mood and everything. So I'm just super excited. And I know that you're just the perfect person, like I said.
Thank you. Yeah, I didn't learn about a lot of this until college or med school, and I feel like it's so important. Whether someone's trying to prevent pregnancy or get pregnant, like understanding ovulation. Like, I've even tried talking to some of my patients, like when I've had, like if they tell me, oh, I'm actually trying to get pregnant, and I'll be like, oh, do you like track your ovulation? Or trying to tell them, I don't know, I had one patient because we were talking about how you do get more libido when you're ovulating, and she said, oh, right before my period. And I was like, no, we have to correct that because she was trying to get pregnant.
Yeah, it's crazy. Like, why do you think we don't learn about this in school?
I feel like so much of anything that's considered sex education is so politicized.
Mhm.
I have taught sex education in Shelby County at public schools, and it's very like you have to get your PowerPoint approved. It's not a part of the actual curriculum. It's actually like an outside organization. It's called a Step Ahead Foundation. They give free contraception throughout Tennessee. I'm sure they're in Nashville too. Uh, like free larks, like just the IUD or the rod. But I feel like it's so politicized. So if someone was like, yeah, we want to teach sex education, it's like, what does that entail? Because it could be like talking about consent and periods, or it could be talking, like for the presentations I gave, it was about the difference between viral and bacterial STDs,
Mhm.
with a very brief slide on contraception and very brief discussion on consent. And I feel like the high schoolers that I was talking to, like they were all so like they were so curious about their bodies, like they wanted to know more information. And it's not fair that we don't teach this and then we just like expect people to go out in the world and I don't know about contraception and the options that are available to them. And yeah, even knowing like what is a healthy period and what is more like dysfunctional that we could probably treat, like that knowledge is empowering to women. So we should teach it. And men should know too, and everything in between.
I know it's crazy. Like I don't think I mean, when I was in high school, at least I feel like, I would have these like mood swings and I never knew what it was. Like even when I did get my period, I didn't know that those things were connected. I knew there was always like, you know, things on social media, like jokes and stuff, like about people making fun of women right before their periods, but that was like the extent of what I knew of what to expect. So yeah, there's just a lot to unpack here. So before we start, I wanted to ask you, so what inspired you to pursue a career as a doctor?
Ooh, for me, I started out at Mississippi State. I wanted to be a veterinarian when I was young. my AP bio teacher took us on a field trip to St. Jude, and the speaker was a veterinarian, and I thought he was so smart. And he was talking, I remember it was TH17 cells he was talking about, and I loved animals, so I was like, I'm gonna go be a veterinarian. But then when I was doing it, like I was like volunteering with the Humane Society and the dog wash, and we had cow patty bingo, and it just was not fulfilling. And I'm more interested in human issues like social rights, like education, health, and so I'm more aligned with human medicine than I am animals. And yeah,
Yeah.
I wanted like aggressive amounts of education, and when I speak on things, I want people to like respect my education. Like I feel like it's not right, but if you have more education, you get listened to a lot more. Like if I want to advocate for reproductive justice and abortion, they're going to listen to an OB-GYN better than maybe, I don't know, some random username on TikTok, which I
Yeah.
also have a random username on TikTok. So it's not right that people do that, but that's how it is.
It's crazy because I went to school also to become a vet. Like my major was in animal science, which is so
Oh,
rare
really?
to
I
meet.
think we talked about this, but I forgot.
Yes, that's crazy, actually. I thought I was the only one, but so what led you to focus specifically on women's health?
I think probably because I was always interested in feminism, and I guess politics and medicine combined.
Mhm.
And then I thought OB-GYN would be too intense for me. And I was shadowing labor and delivery and witnessing just childbirth. It was very moving. It's a very emotional process. And to
Yeah,
watch, I guess, other humans be born and to help assist a woman through some of the most challenging and intimate moments of her life really appealed to me.
that's so beautiful. So how many babies have you delivered so far?
Zero. I've delivered placentas, and actually, the majority of my junior internships that we had to do, I did a lot of gyne onc, so a lot of hysterectomies. I did benign gyne, and then I've assisted, but I would not say that I like when I did the call schedules on the weekends, I did get to still do some C-sections or like assist the C-sections because it's a long road ahead to learn how to do that. But like even getting to rub the baby's back when it first comes out is so meaningful to me. Like it makes me tear up.
Of course. I mean, I've never seen it. I've seen hysterectomies and what else? Like removing fibroids,
Yeah,
it's just basics, but I've never seen the delivery of a child. Like I feel like I would end up crying.
it's incredible.
So, can you briefly talk about some of the research you've done and why those specific topics?
Yes. So my research interests, honestly, I feel like starting out in medicine, you kind of just have to take what comes your way. So I was always asking around or like cold emailing, like if there's a research project that's available, I'd love to be on it. So I did work with Dr. Jennifer Valley. I can't remember which all I've been a part of, but there was some with like sex education for occupational therapists.
I saw that one.
Yes, I helped kind of just write. It's like she'd already done the work before I'd met her, and I just helped finish off writing it. Then with Dr. Anita Prashad, she's an OB-GYN resident. She added me to her menopause, the literature review for menopause perceptions that women have. So I helped kind of filter through different papers. And then as far as I did design a project myself with like provider understanding of postpartum sexual health, which like it had some failures to it, but I still learned from it. And I got to present it at ISWISH. It's the International Society for the Study of Women's Sexual Health. And when I was there, I met some other women who have a group chat around the country, like just people from everywhere, and they'll send in research ideas. So I joined a couple of projects through there. And one of my favorite ones, I forget all of the titles, but it coined the term genitourinary syndrome of lactation and sort of how the hormones involved in lactation affect vaginal health and like your genitourinary tract, which I loved. And right now I'm actually using the SEER database. The CDC runs the SEER database, and I'm looking at anal cancer or people who had both anal cancer and a GYN malignancy or oropharyngeal, just sort of HPV related cancers. And is there a time relationship between these? Like, because if someone had anal cancer, how are we going to know except from their symptoms? And when do we need to screen for anal cancer in patients who've had some sort of GYN dysplasia or malignancy? But I actually just submitted that abstract. It was due Sunday, and I submitted it Sunday because I've been like all over the place lately. But
Yeah,
that's my current work.
that's incredible. So it just seems like I said, like this is just if you had to curate like a specialty for you, Katie, like this would be it. And I'm so proud of you.
Thank
Um,
you.
so let's just get straight into it. So can you explain some of the key hormones involved in a woman's cycle, like estrogen, progesterone, LH, FSH, like just just like elementary school. What is estrogen, progesterone, and what are their like how do they play into our cycle?
Yes, and so I was thinking about the best way to explain it. I think sort of breaking it apart in the four different phases of the cycle would help people understand.
Yeah.
Um, so everyone knows the menstrual cycle, or they know the menstrual phase of the cycle. But it starts off with follicular, then we have ovulation, then the luteal phase, and then menstrual cycle or the menstrual phase. So the follicular phase, I do like to think of it as like our best phase where we're going to have increased levels of estrogen. Okay, so I do have like images here, but I know most people are listening.
You can
So,
you can share your screen if you'd like, if it would just help guide the conversation.
oh yeah, my Word document, I did not make it to be shared. So I don't know if it's the most beautiful, but I think it would help get the point across because I wish everyone could see this. I will just share. Can you see it now?
Yes.
Okay, so this is the very classic figure whenever we talk about the menstrual cycle. I know it's kind of overwhelming at first to look at, but the follicular phase or the proliferative phase, this one, you're going to have higher levels of estrogen, and your body, like we call it follicles in the ovary, they're getting ready to ovulate. Ideally, you would have a dominant follicle, so the estrogen is helping that follicle get, I guess, big and strong to ovulate. And FSH stands for follicle stimulating hormone, which is released by the pituitary, and then we call it the hypothalamic pituitary gonadal axis or the HPG axis. So like the hypothalamus is secreting GnRH, gonadotropin releasing hormone. And then FSH levels, like the pituitary listens to that and they go up. And then the FSH is telling the ovary to create the estrogen. And this estrogen is making the uterus, like if we look at the bottom, I guess the bottom panel, that is supposed to represent the endometrium, and the estrogen is making the endometrium grow and be sort of, I guess,
Like
prolific.
ready for the like for the egg to be fertilized. Like
Yes,
it's making the endometrium like just get ready for whatever could happen, which is
yes. It's
fertilization.
making like a safe and cozy home. And then once all of that has gone on, we're going to move on to the ovulatory phase. Ovulation. So if you look here, this is when we get the luteinizing hormone, which is LH, like that spike. Both FSH and LH levels are going to spike, but especially the LH. And then the ovary will release the mature follicle. It'll go into the fallopian tube and travel down. So it's making its way. But when we do have ovulation, that's when you're going to have like increased libido. A lot of people will feel like unilateral pain that we can coin. It's called Mittelschmerz, if I'm even saying it properly. It's a German word to talk about that pain. And you'll have like bloating, and I don't know how many women like track their discharge, but it's really good to track your discharge because then you'll know if you're ovulating. Like if you get that clear, kind of stretchy egg white is how it's described. That's how you know. That's like increased cervical mucus for when you're ovulating. And yeah, so if you are trying to have a baby, you should have sex when you're ovulating, actually a little bit before you're ovulating. But if you are not, you should never, ever, ever have sex while you're ovulating, or at least be mindful.
So what is the window? Like 4 days or 5 days? Like,
So honestly, I always see 1 to 3 in medical textbooks or literature, but if you look at the period apps, it'll be like 5 to 7, I guess, because they're trying to be extra cautious if someone's using an app. A lot of women, when they are trying to conceive, they actually buy sort of like test kits, which is unnecessary. Or you can get a thermometer and your body temperature will be like a degree hotter
yeah.
um, after you've ovulated. But it's better to have intercourse prior to ovulation if you are trying to get pregnant, um, instead of after. Like, don't wait to ovulate, have it a little bit before. And yeah, and a man's sperm can actually live in your body for, I guess, up to 5 days is what I usually see. So it's like even more like, because honestly, pregnancy is incredible. Like trying to get pregnant, people will try so much and they just can't. And then some people get pregnant quicker, but the body, it's like a miracle that anyone gets pregnant at all when you look at all the factors that we need to support pregnancy. And yeah, and to
So
even have a,
just to understand um this follicle, okay, so I know like us women were born with a set of eggs already, right?
yes.
So what is this follicle just completing maturation? Like that's what it's just completing its maturity after, you know, it's leading up to that uh, you know, uh ovulation period.
Yes. So I honestly, I was trying to look up everything so that I could answer all the questions, but I forgot what phase of meiosis or that it's in.
Yeah,
They're
I
frozen.
think it's meiosis two, like it's completed
Okay.
meiosis two. And like it's crazy because, we are us like as people, our I guess the way to visualize it is our grandma had us in her ovaries. Is that
Yeah.
correct? Yeah.
So okay, I forget. It trips me out. Our if not necessarily our grandmother having us in our ovaries, but when basically you were born with all the eggs you've ever are ever going to have. So if you have grandchildren, no, if your child you were born with your future children in you, I guess your
Yes.
future ovary.
Like my mom, when she was in development, and my grandmother, she was developing her eggs, which is I'm one of the egg that exists now. So
Yes, yes,
that's crazy, but it doesn't complete maturation until that ovulation where it's ready to be fertilized. Correct.
yes.
Okay.
Yeah.
And my second question is, so with this peak of progesterone, is it good or bad? Like you were talking about your follicular phase is kind of like it's kind of giving like, your hottest time period. So is progesterone supposed to be, giving you that like, motivation and feeling yourself? Okay, it's estrogen.
I love estrogen. I should say it's not good or bad. It just is. Like that would be my textbook on paper answer. But me personally, I love estrogen. I love the follicular phase. I hate progesterone. I hate waiting for my period to start. So I'm a progesterone hater, but I should not be like that. It's protective against like for people who have too much estrogen. I know we were trying to focus on like what is a normal period,
Yeah,
but
cancer.
yes. Okay. So yes, because I put that in the document. Too much estrogen, your endometrium is just going to keep proliferating. With more proliferation, you're going to have more, like they could mutate. Just too
Risk
much.
of having cancer because you have so much estrogen, like that
Yes.
feedback is just too much on those cells telling it to, grow or whatever, so it can turn into cancer. But you're saying like estrogen is the best for motivation and just overall like boosting energy and endurance and stuff.
Yes, I love estrogen, and the progesterone is needed because it helps counteract estrogen. Like we need them both together. Like if, for example, in menopause, if someone is getting hormone replacement therapy, if they still have their uterus, they need both estrogen and progesterone so that they don't increase their risk of endometrial cancer. But if they don't have a uterus, like if they had a hysterectomy, they can just take their estrogen and be at peace.
Yeah. So I'm just curious. So even though this is 15 days, like the blue is the progesterone, I thought your ovulatory phase is supposed to be where you are, the happiest or you have the most motivation. How come the
Oh,
blue, if this
we,
is the 15th day, how come the progesterone, you're saying that's the one that kind of makes you tired or fatigued? How come that is the highest on your ovulatory then?
oh no, the progesterone is the blue, and that's the highest, kind of nearing the menstrual cycle, and the estrogen is peaking around ovulation.
No, because it on the primary hormone levels, like the first graph, you see how
Oh, oh, okay, so that's luteinizing hormone. So that's sort of
oh,
like
okay.
this.
Got you. Got you. Okay.
But
I saw both blue and I was confused.
I
Okay.
know this thing is confusing. Like I feel like if we were going to teach this in like sex education, going over this would take an entire hour, probably. Like it is confusing, and I feel like it's so overwhelming at first. But luteinizing hormone is it's peaking, and that's when you ovulate, and then you see it go back down, and it calms itself. But then the ovaries are in charge of making our sex hormones like estrogen and progesterone. This progesterone, if we look at where it says ovarian hormone levels, so where you see that peak of blue, I don't know if you can see my cursor.
Yeah.
Oh, you can. Okay. That's when you start getting like the bloating, the PMS. I know you mentioned mood changes. Okay, so I am interested in like what the reproductive psychiatrists have to say, and it's actually thought instead of thinking that any one hormone level being like out of whack is to blame for like premenstrual depressive or mood dysphoria, whatever they say, it's actually the change in hormones and the fluctuation of hormones that's causing that like postpartum depression or the depression that comes like some people have that cyclical depression, PMDD.
Hmm.
What is that? I forgot what it stands for. Premenstrual. I can't remember if it's dysphoria or depression, premenstrual depressive disorder.
Dysphoric disorder. Yeah.
Oh, dysphoric disorder. Yes. And that is more about the change of hormones rather than thinking that it's just the progesterone or estrogen that's causing it. Because um, I feel really protective of women, and when I see certain like you can find any like online influencer trying to sell supplements or telling them, "Oh, you have low testosterone, low estrogen," but it's like that might be normal for them. Like you can get lab values for that, but it's not routine. Like you don't need them. You do not need your gynecologist to look at your estrogen or progesterone levels.
Mhm.
Um, and yes.
So, what about exercise? So, from my understanding, you know, everyone says that exercise is so good for you. You have to exercise and all this stuff. Is it safe and is it healthy to exercise during your menstrual cycle or during your menstrual phase or your luteal phase?
Yes, it is perfectly fine if they want to. Exercise can actually like release endorphins and help you like manage cramping. Although some of us have cramps, so we're like that's the last thing they want to do. So if someone wanted to lay on the couch with a heating pad, okay. If someone wanted to go to the gym, that's good too. Like we're all different.
Yeah, I heard like yoga, stretching, and walking can help reduce cramps actually, and because it helps like the circulation, the blood circulation, and like the cytokines, like the excessive inflammation and stuff, like it decreases those cramps. So that's really good. But I also heard that you can do I think it's called overtraining syndrome, or something like that. But during your period, if you are exercising too much, you can have something called overtraining syndrome, which is, um, I need to look it up, but it's essentially, it can cause you fatigue for a long period of time and decrease your performance. Also can increase your risk of having an injury because when you're having low estrogen or progesterone, your bone mass or can be distorted. I'm not sure if that is true, but I've read research saying like women shouldn't do heavy lifting during their period. Is that true?
Oh, I actually have not heard of that. I've never heard of the you
Over
called it
overtraining syndrome.
overtraining center. I have not heard of that. I actually want to look it up.
I feel like that would make sense though, because like if you're bleeding, you don't want to put too much stress on the body?
Something that it is bringing to mind is sometimes you can see it in like top level athletes, like they lose their period, and you can also see it in people with disordered eating who lose their period, like for separate reasons. Like one, a lack of nutritional status, and then other the athletes who will lose it, not obviously not the same reason, but some people, if their body is under too much stress and they're not getting the calories they need, or like I guess the stress of training,
Mhm.
their like HPG axis, like they're not going to be creating the hormones in the brain that would tell the ovaries to be producing estrogen and progesterone. So they're not going to have that same monthly cycle. Um, and yeah, if we wanted to put those two in the same bucket of reasons someone could lose their period, which is not good. I know, honestly, something crazy I've learned like through my rotations and what I've heard from people who've practiced obstetrics like outside of the South is that women in the South love not having their period. I relate, but also like we need our periods.
Healthy. Yeah, that's not
Yeah.
healthy. Like, actually, someone asked us a question. They said, "Do you have any recommendation for managing symptoms of PCOS? I was diagnosed with it clinically, but was not a candidate for metformin. I've been trying my best to follow the tips and was told to, I'm still not getting my period regularly." So, like, PCOS, polycystic ovarian syndrome, right?
Yes.
So that one of the symptoms is not getting your period as consistently. Um, so do you have any advice, or do you have any like past experiences dealing with women with PCOS? Also, the fact that it's increasing, PCOS is increasing by the rate that it's at. Why do you think that is?
Ooh. Okay, the first one, so I don't forget, like, why do I think certain diagnoses are increasing? Some of it, PCOS is really hard because, okay, so I guess to talk about the PCOS diagnostic criteria, you have to have two out of three of these things. The cysts on your ovaries, like polycystic appearing ovaries. These cysts are not like regular cysts. Like cyst is not a specific term. So like they'll be like 1 to 3 millimeters, and you'll have multiple of them on both ovaries, and we can look at that with a transvaginal ultrasound. Another one is signs of hyperandrogenism, which it's like
Like hair on your face and
yes,
like balding.
yes, yes, and we call it hirsutism when you have hair on your face. Uh, and then the irregular periods or losing your period, which we would also describe as anovulation, because when that's happening, you don't ovulate regularly, and the cycle is like uh, it's not working as it should be. So you need two out of three of those things to be diagnosed with PCOS. And a lot of people think of it as like if you see like a lot of women with PCOS also struggle with hyperinsulinism. So this it sucks because I feel like doctors will a lot of patients complain like my doctor just wanted to give me metformin and birth control. And then another thing I hear a lot is not addressing the root cause of the issue. We do not know why PCOS occurs. We don't know if it's like diet related, like because a lot of times we do see it with larger individuals. So like we don't know like did the metabolic issues happen first, or was it an effect of like lifestyle? Like we can't say, we really cannot. Like it's like what came first, the chicken or the egg? Um, I also think it could be diet and lifestyle focused, but also we know so much more about like certain disease processes, and women know like I feel like a lot of women have heard of PCOS and endometriosis. So maybe they're going to their doctor and saying, "Hey, can you check me out for this?" And maybe it's being like diagnosed more that way. And so I don't know the true prevalence. That would be really interesting to look into though, like to try to understand. But as far as the question, or did I answer all of that?
She just said like, how do you like what do you suggest? Any tips of just managing it?
Actually, there's a woman I follow online. I think in the next 100 years, like nutritionists or registered dietitians are going to be leading healthcare. And there's a woman I follow who she's a registered dietitian who has PCOS. And she's sort of like, she works with gynecologists too, and she's self-managed her symptoms with diet. I'm going to bring her Instagram up because I really like her. I've tried to show patients this too, but sometimes it's hard. She's called the women's dietitian. Oh no, she's
Okay,
not
I'm,
me.
I'm gonna put it in the
Yes.
description box when I post this.
And honestly, sometimes I get frustrated seeing stuff online because it's hard to know like what is good information because I don't know like I don't have a nutritionist background. Like I don't know what should we be eating, like how can we treat these symptoms. I do know I want to tell people better things than just metformin or birth control. But if you did want to regulate like periods, birth control is a great option. Um, and but it doesn't work for everyone. You could also do you want your, I don't know, I don't want to ask you personal questions, but I would say talking with your doctor and trying to figure out what your goals are. Because if you had the hirsutism, there's medications for that. Like you could take spironolactone or like laser hair removal, like
Oh,
figuring out if that's, what's that?
that medication is awesome for women.
Yes, like getting rid of your acne because a lot like it can help target hormonal acne and it's actually it's like a diuretic that a lot of times is used for blood pressure management, but it's prescribed at a lot lower of a dose if you're trying to target acne or hirsutism. Um, and actually sometimes I've even seen it used in gender affirming care, which is
Yeah,
really cool.
so that's what I was like actually referring to.
Oh, really? Yes.
Like I know that I'm not sure, is it that medication that makes your breast bigger?
Oh my goodness, yes, I forgot it did that. It can even make your breast bigger as a side effect.
Yes, it does. So that's like, and I think that's why we don't prescribe it to men. That's the gynecomastia is the side effect. So,
That is true. Okay, I forgot all of this. It's just so much to medicine.
so tell me, where do you think, what do you think is the future of sex education? Like, I feel like these things as women affect us daily. When is it going to be time that these things are taught in schools? Like, this is your period, and this is how it can affect you, and this is like even boys should know this, like, and learn about it. People with siblings, when they living with women, what to expect. Sometimes she's gonna have low moods, sometimes she's gonna have high moods, and not just the typical, oh, like she's just angry before her. No, like actual scientific conversations about this in the classroom. Like, what is the future of all that, and how are we gonna, help implement these things?
I don't know, because actually I'm really passionate about public health and like increasing like accurate information and not just some crazy person trying to sell you supplements on Instagram and TikTok. Like there's so much misinformation online, but also I feel like there's a lot of pushback when people do try to advocate for sex education in schools because it's like maybe a parent hearing that they're scared that you're going to teach them like I don't know, you can just fill in the blank, like something they don't want their kids taught. I don't know because I really want it taught. Like I see, yeah. Okay, so I have my books here. Like I was like trying to think of what I've read. I could not even in some of my textbooks find like the menstrual cycle diagram. Like it wasn't in Williams Gynecology or Obstetrics, which is like a really like big name textbook used in the field. But um, I don't know. Okay, like I have the Vagina Bible by Dr. Jen Gunter. That's a good resource. Like there's like books that doctors have written. That's just one I have, but there's others if someone didn't like her writing style or her like tone. And then like this was my first period book, or like The American Girl. I think so many young girls had this, but it talked to you about your period. And I was given this book and I loved it. Maybe that was foreshadowing, but I don't know. I would like it to be taught. I think we get a lot of pushback and it feels like progress will be made and then it gets stripped away. So I think I just want women to feel empowered to be able to talk about their bodies and know what's going on and advocate for themselves at the doctor's office. And yeah, I remember I was so like embarrassed that I had my period. I was 12. I was the first of my sisters to get it, and I was like very hush-hushed about it. And I guess I would just hope for future generations not to feel that way or to feel like that shame and embarrassment about being a woman. Because I feel like it was so prevalent and it was like, oh, we don't talk about this and we hide our tampons and we hide our pads. I would just want that to stop.
I mean, it's like I said, like it's crazy that 50% of the population experiences this on a monthly cycle. Like, and it's still something that we try to hide. I just don't understand, like, I don't know who started that, but they
Yeah.
stopped. And another thing is, I mean, we didn't talk about this, but what about appetite and cravings? So why does that happen? And when is it most, likely to happen?
Okay, I'm gonna blame that one on progesterone. I already said I hate it, but progesterone actually does cause like increased appetite. So you're probably more likely to get that in the luteal phase, which we can think of as the second half of your period. I guess honestly, it's more like a circle because it is a cycle. So I think of it as the second half, like because the diagram always shows follicular starting first, then ovulatory, then luteal, then
I think
menstrual.
of it like that too. And someone actually, I don't remember who did this because right now it's kind of a trending topic, but follicular is like spring. Okay, you're like getting ready for something exciting coming up, and then like summer is like that's hot girl summer. That's your ovulatory. So you're at your peak. It's like you have the most energy, you're ready to go outside, like you just want to have a good time. And then your fall, that's like your luteal. So like your energy levels are starting to decrease and you just want to stay in and your energy levels are not as much and then and then finally your menstrual is like that's winter like I'm in the house, I'm not going outside, I'm staying in, I'm relaxing, I'm taking hot baths. So that's kind of how I like try and remember it now is with the seasons. I'm like, okay, which season are we in? Not like which phase, but which season.
It's actually really funny because I've seen the memes, but I haven't seen that one. I like it.
Yeah. So like how could we, I guess, prepare for, you know, those things coming up? Like, is there a specific regimen that you recommend? Like, or and why is it important to know what is coming up? Like, as a medical student, did that ever affect your, motivation for school or anything?
I did always like I would be I would tell my friends like they know that I say this all the time is that I hope my period starts so I'll be like on the estrogen predominant I guess time of my cycle like if I had a test coming up. But honestly, no, you get stuff done. I mean, no one wants to be cramping and bleeding when they have a big test, but honestly, I would say if something works for someone, they should do it. I use my heating pad a lot because it just makes me feel better, like when I'm cramping. But other than that, or like, oh, I did want to say if someone was trying to take medications for cramping, I would advise NSAIDs because
Anti-inflammatory.
yes. Yes, the way the medications work, like not using Tylenol, just go for the NSAIDs if you unless you have kidney issues. I don't know, there's so many like caveats like that we would have to address, but endometrial tissue has prostaglandins released from like the spiral arteries of the endometrium, uh like when it's I guess degenerating and like shedding. But using NSAIDs works a lot better than Tylenol. That's the only point I wanted to make.
Yeah, a lot of people don't tell you that. Like, I think I used to take Tylenol before I got my master's in pharmacology. Like, I was grown. Like, and I was like, wait a second. Like, gives you the perception that there is no pain, but ibuprofen actually like addresses the inflammation part. Like, that's
Yeah.
mind-blowing. You don't know, or like Tylenol's for headaches and ibuprofen is for like inflammation. You don't know that stuff until like it's just crazy that that is not common knowledge, you know?
It is, and there's even some thinking that NSAIDs can help make your period lighter, which like is not really accurate. Like it may make it like slightly lighter. I've actually tried, and like there's something like maybe 30% of women said they noticed a decrease, but ACOG, the American College of Obstetricians and Gynecologists, actually posted on their Instagram like a warning saying, "Stop trying to take all these NSAIDs to stop your period. Like you will damage your kidneys." So people know certain things or they notice them, and then if they take matters into their own hands, I would just want them to know certain risks.
Exactly. And another thing with these medications is, like you need to have we should have periods. Like they help us as women to this is like more of like a psychological aspect, but I believe they can help us like reflect and be in different like mental spaces where we're able to see life in a different perspective, like those seasons I was talking about. And like trying to stop your period is not healthy. Like if
No.
you don't have a period, actually, that's probably a red flag or a risk factor for something that might be underlying, that's going on. So,
Yeah.
and
Well, if someone wanted to get rid of their period with like a progesterone IUD, or like some people
yeah,
can,
that's different. Yeah.
yes, that's different. Yes.
But if you're like just a like regular schmegular person like trying to go on TikTok and see how you could stop your period, like don't do that. Like
Yes,
don't.
don't like, I guess with like extreme amounts of NSAIDs or like starvation, which is scary.
Yeah, exactly. Well, is there anything else that you would like us to know or any advice you want to give the girls on um, just having a healthier lifestyle and overall just strategies to help us feel more balanced throughout the month?
Well, maybe one thing I did want to bring up, because it always aggravates me, is like you cannot change the smell of your vagina. Also, I'm not aggravated at women trying like being more body conscious. I'm aggravated by like honestly, I think it's misogynistic to try and push like I guess any supplements I've seen trying to make your vagina smell better, or like telling women that drinking pineapple juice or eating a bunch of fruit is going to make their vagina taste sweeter, because that is not true. Like the vagina does not concentrate metabolites. Like if you want to eat, I guess, a bunch of garlic and onions like right before a date night, like you are not going to smell worse. Like maybe, okay, you know what? I think it can get in body odor, but not necessarily the vagina. Um, yeah, that was my one point I put on. That's all I can say about diet and how it affects the vaginal microbiome. I guess sometimes people with diabetes might have increased vaginal yeast infection, so that's another indicator of health. But outside of those 2 points, no.
Awesome. Well, thank you so much for, making time to talk. I had such a good time and, good luck with all your interviews coming up and we're cheering you on. You're gonna do amazing.
Thank you. Thank you for inviting me to do this. This was really fun.
Thank you so much. All right. Well, that concludes our um, episode on the Nashville Network Alliance. Thanks again for tuning in, and we can't wait to see you on the next episode. Take care.